Good afternoon. This is your County Executive Ed Day for your weekly COVID-19 update, and plus a reminder, which you probably are staring at right now. Our 2020 census. We are still a little short. Our self-report right now is an area of about 69%. Last time we had this census in 2010, we're at 71%. We're still doing much better than the state. However, we do need you to engage in the 2020 census, and you can do that by going to 2020census.gov. One second, so you can hear me. 2020census.gov. Please get counted. We have 2 weeks. We have till September 30th to do this. So I just want to bring a stark reminder to all of you that the census is still going on, and we do need your assistance. A lot of federal dollars are at play here, and if the federal government's going to be doling out cash, we want to get some here in Rockland, that's for sure, okay? So, in any event, again, thank you for being here today. Yesterday afternoon, our planning department, through their partnership with the health department, launched some new resources that are now available to all of you. It's something I think you're going to find very interesting. Now that when you visit rocklandgov.com, it's rocklandgov.com, our website, you will see a link to our dashboard hub page, which has our map on pause and early warning dashboards in one place. So it's a little bit easier to navigate now than it was before. There are also links to the trackers created by New York State and Johns Hopkins University. So, but the newest edition, which we're very proud of, we received several questions about here on Facebook, and there's a response to that, is our active case map, which you can view now on that map dashboard. And this is what it looks like. And we got that, John?
Yep.
Looking good?
Looks good.
Okay, this is the active case map. It's very difficult, obviously, to see this on screen, but this is what it looks like. So when you go to rocklandgov.com and you click on the map, there's one of the maps that are available. The older map is a map that is historical in nature, gives you the totals up to date. We want to bring more current information to you because where we were is not where we are, and certainly, hopefully, not where we're going. So we want to bring current information to you. So this is something that was put together by planning and a health department. I want to thank both the departments and their staff for doing the work. It will show you again, it's hard to see this, but it'll show the active case numbers by zip code. These numbers are based on confirmed positive results dated within the last 2 weeks. 2 weeks, as you know, is the incubation time that we utilize. And we use the information, obviously, is reported to the Rockland County Department of Health. The active case map will be updated on Monday, on Wednesday, and on Friday. To emphasize, when it comes to these active cases, someone is tested positive for the disease. That does not mean they are overtly sick or they're gravely ill or anything along those lines. It doesn't necessarily mean that. They can even be symptomatic. Asymptomatic. So, when you see these cases, I want everybody to understand that these are people who have tested positive. No more than that. And again, there's more to the process. To put some perspective on this, right now we have 272 active cases here in Rockland. That is less than 0.1% of our population. 0.1%. So I just want to put that in some kind of perspective and context. So when we hear about COVID-19, obviously we're concerned. Some people are getting a little anxious. It's important that we put this in perspective also. So I just wanted to share that with you. Also, we look at what could be a real good benchmark for us to look at as it relates to the impact of COVID on this community. Probably the most accurate number to measure the severity of the infection locally is the numbers of people hospitalized by the disease. Today, we have only 6 people hospitalized who have confirmed to have COVID, and we have 3 who are under investigation that may have COVID. And again, to give a picture of where we were to where we are, this is up here by top, my right finger here. This is where we were. Obviously, it's going back in March, April. This is where we are now, and if you look at the bottom of this, we've been flat, pretty flat for quite a while now. So it's something I think it's important to speak of. We've been like this since mid-June on this flat. So when we talk about flatten the curve, we have certainly done that here in Rockland County. They're steady. We have not seen much movement whatsoever. Again, things are looking much better. To put a numerical perspective on it, we are down from a high of nearly 400 people in the hospital to where we are right now. And again, it also represents the fact that the hospitalization rate for testing positive for COVID is a mere 3%. So we have made incredible progress here. 3% of that number of cases, 3% represents what will be in the hospital, 9 people right now. So anyway, we've held steady through the summer with less than a dozen new cases a day. We're seeing some more people test positive now. And again, I offer this as information, not in any way, shape, or form to overly concern people. This is a matter-of-fact presentation that we're giving you right here. We have had more than 20 positive results almost every day in September. And while this is due to a number of factors that we have spoken about before, but includes our college students from Rockland who are testing positive, aren't even necessarily coming home, but they put their home address down naturally, elsewhere, and being counted in our local numbers. So we have to remain vigilant. We don't want to overreact, but we want to remain vigilant about what we're up against. This virus is, can obviously, nobody really has a total grasp on what it's all about, but we do know some things that we have learned our lessons from that seemingly work to keep us healthy. In order to keep our local economy, businesses and our economy moving in the right direction, we must keep these numbers low. There's no getting around it. We cannot afford to give the governor any excuse to close our businesses down again. That is a non-starter. So how do we do that? We do it to making sure that we understand that, like it or not, we have to learn to live with this disease. And you have heard me speak to this many, many times, but only for the time being. We are seeing a lot of positive information coming out as it relates to a vaccine, most notably when we will all take pride in Pfizer. The CEO was quoted yesterday, I believe, John, saying some very positive things as far as the timeline is concerned. So, the more people are going to test positive, but we cannot return to the situation we saw earlier when we saw hundreds hospitalized. And it's a big difference between now and then, obviously. So let's make sure we continue going in the right direction. I remind all residents to continue taking the precautions that has helped bring us to this point. Maintain social distancing, wear a face covering when you cannot maintain social distancing, and wash your hands for at least 20 seconds. And again, worst thing you can do if you're out and about touching things, even though the latest information we have is that the contact of objects and the transmission in that matter is not as of a concern as it was earlier. You still can contract it. So the worst thing you do is don't touch your eyes. It's the one thing you just do not want to do. This disease is largely preventable just by witnessing how many people are getting sick. But they're relatively easy habits that we're talking about. And it's not rocket science. I mean, it's simple prevention of doing some of the simple things you talked about. And as an added bonus, it's flu season's coming upon us. So I can guarantee you, I will guarantee you that some of the same things you're doing now to protect yourselves from COVID-19 will help you protect you from the flu. And again, because these are common sense strategies that have been around for a while, except for the mask, obviously. But keeping out of people's faces is a good idea. Washing your hands, keeping them clean is a good idea. Not touching your eyes or your face before, at all is a good idea. Those things have been steady. We've added the mask, obviously, to the strategy, just where we are right now. But again, these are strategies we learned as kids. We taught our children. So just continue doing that. And right now, I'm going to turn things over to John Lyon, and our man behind the curtain, who's been fielding your questions. John, what do we have?
Before we jump into the questions, one thing, you talk about things we do recommend and don't recommend. I also don't recommend. I was at a grocery store, which I will not name, over the weekend. I got back into my car afterwards, sanitized my hands. I looked over a couple cars next to me. A gentleman was picking his nose either before or after going to the grocery store. We do not recommend that type of behavior. That's not helpful.
I believe you'll get complete agreement on that one. That one I did not see coming, I have to say.
I don't think anyone will argue with that one. First, thank you to everyone who wrote in today with your questions. The first one's pretty straightforward. What is the plan to prevent further increases in cases here in Rockland?
The plan really is quite simple. Social distance, wear a mask if you can't stay 6 feet apart, and wash your hands. And we've heard this over and over again. These precautions are very important. Throughout the summer, we have distributed thousands of masks because we obviously need other strategies besides requesting people to follow the rules. We've distributed thousands of face masks to businesses and residents through Office of Economic Development, through our Department of Health, our Department of our Veteran Services Agency, our Office of the Aging, and our Human Rights Commission. We continue to do everything possible in order to disrupt the transmission of the virus. That includes case investigations. When we get a positive, it is handled just like a detective in a police detective division. That's exactly what it's done. They look at everything that person had done, where he or she had been. We engage obviously in contact tracing. We partner with nonprofits and we partner with community groups to see that masks are distributed to those who need them, and most importantly, proper measures are being taken. We work with local groups to help us help them to educate people who are part of their group to understand what they should be doing and the importance of it all. And that's really what's is the critical issue. It's important, and it's important not just to you. It's important to your family. It's important to your friends. Transmission of this virus can kill. And again, we have not, thankfully, I think we had one death over a number of weeks here in Rockland County. Again, we've come a long way. Any death is a tragedy, and we can prevent those deaths many times by being smart. So that's really the extent of it.
Absolutely. And the next question dives a little deeper into that. What are our contract tracers? What are they finding? What are they seeing when they investigate these cases?
That's a good question. Some positive news, and this is a very positive thing. Our contact tracers have not yet found any clusters or any large spreader events. That's a positive. They continue to investigate each positive test result so people who have been exposed can take protective actions such as isolation or quarantine, with the goal of breaking the chain of transmission. And I've said this many times, it's the same strategy we use with measles, contact tracing. Nobody ever heard of it before. Well, again, I will just reassure people here in Rockland County that this is not our first rodeo. I mean, many other counties, pretty much almost every county, except maybe Brooklyn, has not had an experience like with the measles like we did. So we've been down this road before. The important factor to remember is that oftentimes, by the time we get the test results, it could be 3 or 4 days after commercial laboratories get the results in. And that, unfortunately, to an extent, there will probably be some damage done. It just means more work. But the case investigation work that the Department of Health does is critical. But most exposures have already taken place by the time investigators begin. So again, we're a little behind the 8 ball. But what we do is we continue to drill down to where people have gone, who they've been in contact with, and follow up to those locations as those other people to help them understand they have been exposed, and we would go into the details of what the recommendations of the health department would be depending on what the exposure dynamics truly were. We act to contain further spread by maintaining social distancing at all times is where the greatest impact comes from. And when it comes to public health, prevention is always the best policy. I know I just read something the other day where I think it was a teacher came into school or administrator. She was not feeling well, okay? And she came into school, did a lot of walking around in the building. It was not, we don't know right now. Now what is she stayed home and she's being tested. If you're not feeling well, if there's any way possible, please stay home. Don't go to work. Don't put other people at risk, particularly at this time of year where we finally have a handle on the COVID-19 crisis, and we are now entering the flu season. It's just, if you can avoid people when you're feeling ill, please do so. And I know we've all heard the phrase, an ounce of prevention is worth a pound of cure. It holds true when we're dealing with this disease.
And we continue to see questions like this come up. What can be done about reporting businesses or people who aren't following the governor's orders? The person who wrote in says they've made many reports, but nothing's being done in some particular circumstances.
Okay. Well, first of all, we don't know if nothing's been done. I mean, it could have been a visit. There probably was a visit by someone, either the law enforcement or the Department of Health as a follow-up if the complaint was made to the PAWS hotline, which I'll give you in a moment. So, nothing being done may not be accurate. We don't know, but we just don't know. And I see a lot of, I saw one photo on Facebook over the past couple of days that I know probably nobody who actually saw it was sending me the pictures, but I appreciate the information, always do. But critically important, you call law enforcement out of the gate if you see what's going on. Now, first of all, let's make sure that they are potential violations. If you see people, for example, if you have a table of 10 people and they're sitting at a table together without masks, they are not in violation. One of these pictures that I saw, the best picture I had was the one of a table of 10 with people without masks. They're not required to wear masks if they're sitting at a table. When they get up and walk around, they're supposed to wear masks. If you see a couple together, common sense tells us, obviously, if it's a couple, they're not going to be wearing masks, or they don't have to wear a mask. As it relates to enforcement, the enforcement of the governor's orders, and I've said this before, is specifically law enforcement agencies that are empowered by the governor to enforce his executive orders. That is just a fact of life. Now, if a local business is not taking action, you can try calling the ownership or the corporations if there is one. That's oftentimes is a very good strategy. Oftentimes the corporate office is not aware of this. Oftentimes a local business owner, who already is working, 28 hours a day, trying to get a break, may not be aware of it, and you may be helping them. This worked well when I was a civic association president. We saw people zooming through our community. We would get the number of the truck and the phone number of the business and call the owner. And believe me, it did work. So that's another strategy you can use. If you call the police and you are not satisfied with the police response, I would suggest that you first bring that matter to a police supervisor, because there may be facts that you're not aware of, and also if the response has been less than meritorious, it's an opportunity for the supervisor, his or her, the officer's frontline supervisor, to opportunity to instruct the officer in what to do going forward. It's an improvement of service. It's a very good thing to do. Finally, if you are still frustrated and you're still not getting any answers, you can go to the police supervising authority, which would be either a town supervisor or a town board member if you are in a town with all 5 police forces, or if you're in a village with a police force, such as Suffern and Spring Valley, you would speak to the village mayor there, and or a trustee. County government does not have direct oversight nor control of towns and villages. I think most people know that, but it bears repeating. But there is a state hotline, and again, it's a 24/7 line, so you can make calls directly there, and what they will do is they will triage those calls to the localities, and there will be visits made, or even mailings done at times by our Department of Health here in Rockland County. So that number is 833-789-0470, 833-789-0470.
Okay. And we got a question about the interpretation of some of the new dashboard numbers from the active case map.
Right.
What exactly does active cases refer to? Are they new cases reported during the time period, or previously reported cases where people might still be sick?
Got it. Okay, very good. It's an excellent question. Active cases that are displayed on our map refer to the new positive results from within the last 2 weeks. Again, 2 weeks being that window where we look at it as being somebody who could be infected, and after 2 weeks, we'll be through the worst part of it, and it's been confirmed by the Department of Health. So that's the two points we look at. The 2-week frame is based on the time frame a person who is tested positive is required to isolate under our health commissioner's orders. And basically, what happens is it's a rolling number. First person on the list will be the first person off the list after 2 weeks. So names will be, cases will be coming on. Monday, Wednesday, and Friday will be posted. Obviously, if somebody's reached that 2-week period, they will come off the list. So you can have a rolling number of active cases that are 2 weeks, whether it be a person with 3 days or 12 days, they're still within the 2-week window. For your information, and this is important for people's, again, to deal with some people's anxiety and concerns, and they're understandable. The contact tracing teams follow up with individuals every day to ensure they are staying home and they are isolating. So it's not that we just tell them stay home. We physically will check with them or call them to make sure they are abiding by the directive of the health commissioner.
Absolutely. And we received a number of questions today and yesterday about the possibility of the governor canceling Halloween this year. Terrible. It's on a Saturday, too. What's going on with that?
Okay. When I first saw this on Facebook, I was stunned. I'll be very frank with you. I just could not believe that was even a consideration. But in any event, I do have good news I will convey on behalf of the governor. The governor announced earlier today he was not going to cancel Halloween trick-or-treating in New York State. I cannot even begin to talk about Thanksgiving and Christmas, and I just am not going to get it, or Hanukkah. But I will quote the governor. If you want to go for a walk with your child through the neighborhood, I'm not going to tell you can't take your child through the neighborhood. I'm not going to do that. I'm going to give you my advice and guidance, and then you will make a decision and what you will do that night. I want to applaud the governor for letting parents be parents, because you know something, this is a parental decision. I couldn't even begin to envision if I want to take my children trick or treating, I would have to probably fall afoul of the governor's directive, because I think it's a bit of an overreach. You know, I said I was interviewed by Wall Street Journal a while back, and I said that guidance from Albany is good, ruling from Albany is not. That is where some of the problems we have right now in getting information at times. They're taking on a lot of work. I know some of the people in the governor's office who've been working on the questions that you get to us, that we get to them. It's overwhelming because it's centralized, way too centralized, in my humble view. And I'm based on a background of emergency management myself from law enforcement. So you can take the little ones out, go out and go trick or treating. It's on a Saturday night, as you said, which is great. Just exercise safety precautions. Make sure if you're out and it's a little dark, make sure that the children can be seen. Flashlights are great to have with them. Make sure that they understand not to go running into the street, things of that nature, things that I haven't done in many, many years, frankly. But in any event, if you go trick-or-treating, have a wonderful Halloween. Do we have anything else, John?
There's also an opportunity if you're looking for a costume for your child, or creating one or making one yourself, to work the mask into part of the costume. Get creative, figure out a way to do it safely if you are going door to door.
Okay. With that, we will be meeting again well before Halloween. That's for sure. But in any event, again, I hope the information here has been helpful to you. Again, our goal here is to provide information. We're not here to frighten or cause anxiety to people. Quite the contrary, what we want to do is give you information so you are less anxious. This has been a very trying year for everybody in this nation and in this world, and it's not easy to get through with all the things that are going on. We've had some tragedies here, but right now in the state and also in Rockland County, we're doing much better. Things have reached a calm now. Our curve has been flattened and then some, so we're doing well here, and we believe that bringing information to you will be helpful to you, so you see what we're seeing to the extent that we can share it with you, and give you some sense of calm. I mean, if nothing else, we have lives to live. And, the bottom line is that I've said it before, this virus is with us. We can't kick it in the butt and send it home. We have no vaccines as of yet. We have no natural immunity that we know of. So we're left with certain tools that we can use to protect ourselves. So as we mentioned before, social distancing, face coverings, wash your hands, keep your hands off your face, common sense things that will keep you healthy to begin with, but actually are even more important now. So with that, you have yourself a wonderful afternoon, and we will see you next Tuesday at 4:15.